Hi, everybody. Welcome to our community vaccine discussion. I'm Heather Comstock with the Image Center, and with me is Cheryl Grossman, who is our vaccine outreach coordinator working in conjunction with the Baltimore City Health Department. I'm going to turn things over to Cheryl so she can introduce our topic tonight.
Hello, everyone. Thank you so much, Heather, and thank you, everyone, for being here tonight. Again, my name is Cheryl Grossman. I'm the Equitable Vaccine Response Coordinator for the Image Center, and I'm also the Disabilities and Underlying Conditions Values Team Lead. That's DUC, D-U-C, affectionately. And I'm here with a couple of my ambassadors, our ambassadors for Baltimore City's Health Department, Kiana Mayo and Natasha Gregg. Kiana is going to be helping lead our vaccine discussion tonight. Natasha is going to help us by jumping in, suggesting new directions. So let me just give a very brief overview before I turn it over to Kiana. So what we're doing with Baltimore City is working to ensure that Baltimore City Health Department and other Baltimore City staff members understand how to make their programs and services more accessible and more inclusive for people with disabilities, especially during this time of pandemic, COVID-19. We're also working hard to ensure that the city's partners, that's community-based organizations, elected officials, and any other entity that contracts with the city, also understands their obligations to make things more accessible and more inclusive for people with disabilities. The end result, we hope, will be more and better information about COVID-19, about treatments, about the vaccine, about places to go, alternative formats, and many other things to happen. If you have any questions about the program, about what we do, about what we offer, you can always ask our DUC team. You can reach them through me. My phone number, area code 314-863-3211. Or you can reach me by email, sgrossman, GROSSMAN, at imagemd, IMAGEMD.org. And with that, I'm going to turn it over to Kiana Mayo to help facilitate our discussion. Go ahead, Kiana.
Thank you, Cheryl. I hope everyone is having a good night. My name is Kiana Mayo. And we had some questions come in tonight. It was a very informal discussion. First question, will the vaccine give me COVID-19? No, the vaccine being used cannot infect someone with the virus that causes COVID-19. What are the long-term effects of the virus? Of the vaccine, excuse me. We do not know the long-term effects. However, over 200 million people in the US and 300,000 in Baltimore have received at least one dose of the vaccine alone. But we do understand the long-term effects of COVID can be devastating, even on people who do not have underlying health conditions. Why should I get the vaccine if I could still get COVID-19? No vaccine is 100% effective. The vaccine provides you from severe illness and being admitted to the hospital, but it also protects the people around you, anyone who is immune compromised or who is too young to get the vaccine. Okay, the next question. What proof of disability do I need to show to get a booster or third dose of the vaccine? None. If you have a vaccination card, you should bring that with you, but you do not need to prove your disability to be able to get the vaccine. All right. Next question. Is it safe to get a different vaccine than I previously got? Yes, it is safe to mix and match. If someone got the J&J vaccine, the Johnson & Johnson's, and it has been longer than 2 months, they would be eligible for a booster. In many studies, the Moderna vaccine paired better for people that got the J&J. All right. I'm concerned about giving my child the vaccine because I feel it was rushed. The mRNA technology has been studied and used in other treatments for years. Okay. What if the website is not accessible to me? How can I get information about COVID-19? Most of the accessible information comes from the CDC. However, you can contact our duck team and we will do our best to get you those materials that you need. Okay. Next question. I am immune compromised and I do not understand if I should get a third or fourth dose. All right. A third dose would be a full dose, and the fourth dose would only be half of that. Yeah. Cheryl, did you have anything you wanted to add to that question?
This is Cheryl. Thank you so much. Just to clarify, the full dose, that is the third dose, we are talking about Moderna. And the fourth dose, that's Moderna also. If you are immune compromised and you're working with the Pfizer vaccine, that's 3 doses, and that's all the same dose. Therefore, the 2 different products are both using mRNA technology, but they're different formulations. They're not exactly the same. And so that's why the 2 products have 2 different ways of being administered. If you're immunocompromised and you're worried that you haven't created enough antibody or you haven't created antibody to COVID-19 after the 2-shot vaccination, then you should consider getting a booster and possibly a 4th dose. If you got J&J and you're concerned about the same, after 2 months, you can get another J&J vaccine, or you can pair it with Moderna or Pfizer. Since this is a newer way of being authorized by the FDA, we only have a certain amount of data. And the studies so far that show good results were done using J&J and Moderna when paired together. The data for J&J and Pfizer is not out yet. So not necessarily that it doesn't work as effectively, we just don't know enough quite yet to have the new studies released. Does anyone else have
Yes, Cheryl, I have a question.
Go for it.
So if you had the J&J and then you got get a second shot with Moderna or Pfizer, do you then need to go back for the second Moderna or Pfizer shot?
So Cheryl, Kiana, jump in if you want to, but my understanding on this is that right now they're suggesting 1 dose of another product. And right now they're doing studies to see how long that immunity lasts and whether it would be more effective to do a full series of the mRNA vaccine. It's too early for those studies yet. Right now, what we know is that when someone mixes and matches, they're getting good results in terms of antibodies right after. So it's just like when the vaccines first came out, and this first studies show good effectiveness at hitting appropriate antibody levels for protection. That's what we know right now, and in the coming months, we'll have much more information about it. And since there are several weeks in between the doses, and immunity tends to stick around at least 6 months for the mRNA products, there's some time for that data to come in before people would be eligible for the next dose.
Awesome, thank you.
Okay, our next question. Once you get the vaccine, will we have to get it every year? Right now, we do not know. But however, we do get other vaccines, such as the flu shot, chickenpox, measles. We do get those at different times. How does someone who needs physical access or alternative formatted material at a clinic request that? If you need any reasonable accommodation, you can request that when you call the call center. And the call center is open Monday through Friday from 8:30 a.m. to 6:30 p.m. And that number is 443-984-8650. And you can also go to the website covax.baltimorecity.gov. Also, if you need accessible transportation, MGM, who provides the free service, is not open on weekends to schedule a ride, or if you have issues with your ride not showing up. But that number to call to schedule during the weekday is area code 410-372-3444. Or you can also email them at COVID transportation at mjminterventions.com. And I'll spell that out. That's COVIDTransport at mjminterventions.com. Next question. Are vaccines safe for pregnant women? Yes. Pregnant women are at high risk of getting very sick, so the vaccine will protect them. Yeah. Also, the vaccine does not keep you from getting pregnant. Yes. If you are deaf or hard of hearing, how can you contact the call center? Unfortunately, the city does not have a teleconference video chat feature set up to assist people, but you can use Maryland Relay, and they should be able to help you with dialing 711 to place a call through Maryland Relay. Do I need to show proof of insurance to get the vaccine? No. They should not be asking for proof of insurance. Are there any side effects to the vaccine? You could have some side effects from the vaccine, but that is just means that your body is building up the protection that you need if in fact you contact COVID-19. However, we do know that the effects of COVID-19 are much worse than any side effect that you could get from the vaccine. If someone is not able to leave their house, can someone bring the vaccine to them? Yes, you can make arrangements by calling the call center, and I'll give that number again. It's area code 443-984-6850. And our next question, I'm afraid my job may not give me the time off if I get sick. First, I would say to talk to your employer. And if after that you still feel that you're not being heard, you can contact our team and we can advocate on your behalf. And Cheryl, you have anything to add to that last one?
This is Cheryl. I will attempt to do so without freezing again. My apologies. Technology is not my friend tonight. If you're having difficulty with your employer, please contact us. We might be able to suggest additional ways of communicating and additional talking points that may help your employer. It's also important to note that if an employer has 100 or more employees, the federal administration is mandating that those employers provide not only time off to get the vaccine, but also time off for any recovery that is needed. We recognize that this is limited in that there was not money provided to the employers to cover somebody's time off. So some employers are still having difficulty making sure that this happened. It also did not say anything about having to take time off to take care of someone else who has gotten the vaccine and is needing extra recovery time. So those may still be sticking points, but we encourage you to communicate with your employer, or for that matter, your school or your child's school, if need be. If we can help at all, please do give us a ring or email us. Back to you, Kiana.
Well, that was actually all of the questions that I have, Cheryl, unless Heather had some other ones that may have came in.
I have actually a question, because one of the common things that I've heard people say is they're concerned about being allergic to ingredients in the vaccine. And it's my understanding is there are lists of ingredients available on the internet, like you can research from the manufacturer and they can tell you, but was that a complete list if you're somebody who might be sensitive to some of the ingredients?
This is Cheryl. These are regulated products under the FDA, the Federal Food and Drug Administration. And those are listed online. You can see them. The main ingredients that are that tend to get mentioned are preservatives. And just like with other vaccines and other medications, there are preservatives. And sometimes, in very rare instances, people can be sensitive or allergic to certain preservatives. There have been noted some cases where people on certain medications or with certain underlying conditions might be more sensitive to certain preservatives in these vaccines. Many of these individuals are already under doctor's care. And anecdotally, I have heard from those who have had difficulty with preservatives in vaccines in the past that their own doctors have suggested that they take the vaccine because the risk of COVID is and dying from COVID is higher than the risk of an allergic reaction to preservative in the product. If you have questions or concerns and you're on a medication that has given you difficulties with this in the past, you might want to check in with the provider of that medication. It is also possible that when getting that vaccine, if you are concerned about allergies, that you might want to take that vaccine at a location like a doctor's office that has access to emergency medical provision. Every clinic has basic EMT provisions, but a doctor's office might have a little bit more infrastructure to assist if you're concerned.
Thank you. That was very comprehensive. I appreciate it.
This is Cheryl. Also, I will add that both mRNA vaccines, Pfizer and Moderna, I believe both of them. I know for a fact Pfizer does. I'm pretty sure that Moderna also has a very, very small amount of sugar solution, which is very common in medications, especially in vaccines. If you're diabetic, just understand that it may affect your blood sugar right away.
Kiana, I don't see any additional questions. Does anyone else in the audience have any questions they'd like to ask?
This is Natasha. I was recently stumped on a question where the best answer I could give was you might want to reach out to your provider for that information. But the question was a person knew that they were going to need to be hospitalized for a short time. And because they've heard that so many places have a lot of staff that, for whatever reason, are not vaccinated, they were concerned about getting a booster just in case. And they're right at the cusp of age. They have general health, generally good health, but they're at that age range where we suggest strongly for them to get a booster. I myself was in a nursing home not long ago, and I got COVID for the second time in that nursing home. And these people were supposed to get shots all the time, but there were two outbreaks of COVID while I was there. So while I wanted to emotionally answer that, I had to pull back to the practical answer. But I would like to know, what would you say is the best answer for something like
Hmm.
This is Cheryl. Kiana, do you want to take that?
Well, you can take, this is Kiana. You can take that one, Cheryl.
This is Cheryl. Sure. I mean, if you are at risk in any way, shape, or form of getting COVID-19, whether because you have an underlying condition or because you're on a medication that makes you more susceptible, or if you're of an age that makes you more susceptible, or if you're taking care of children who have not been eligible yet, and this is, of course, changing now. But if you have children under the age of 5 who cannot get vaccinated yet, if you work in a setting that puts you at more risk, if you are recreating in a space that puts you at higher risk, and I would suggest if you're getting medical care in a place that puts you at higher risk, then you might want to consider getting that booster. Again, this is a personal decision, and you want to weigh the pros and cons, just like you would with any other thing that you do, any other medication that you take. What we do know for a fact is that COVID can kill, and COVID can make you very sick. Those same consequences are not, with very, very, very rare exceptions, the case for a vaccine.
Okay, similar. All right. I think I, for the most part, made the best answer I could have given them, being caught off guard, but I hear what you say. So thank you very much, Cheryl.
So we had a question that came in, asking what, can you guys talk about some of the things that are underway for people who cannot get to a vaccine site and get vaccinated? What are some of the things that are being done to help reach out to people who need to be vaccinated at home, either because they have small children and no childcare, or because they can't leave their home? Can you describe some of the things that are available to help people get vaccinated at home and how they would do that?
Yes, I can take that. We do have a partner that will come to the home to vaccinate anyone who does need that service. And again, I'll put the call center number in there. The area code is 413-984-8650. And I'll say that again. The area code is 443-984-8650.
So getting vaccinated at home is not necessarily dependent on having a disability. It can be people who have children or lack of transportation or caregiving for someone who can't be left, correct?
This is Cheryl. That is correct. The original definition that Baltimore City chose for what they used to call their homebound vaccination program, that is now known as the Vax at Home program. The criteria was from Medicare and then the CDC. And the stipulation was that you were eligible for the program if you had difficulty getting out. And they specified what difficulty getting out of the home meant. And that included the use of accessible transportation, the use of a personal care attendant, or the use of a mobility device. That was expanded to simply the phrase, if you have difficulty getting out of the home. That would include those who are single parents, have kids virtually in school from a kitchen table, you can't, leave. It would, cover for social anxiety. You just don't want to put yourself out into the world right now. So yeah, it's a very broad definition. If you need help getting to that vaccine or getting that vaccine to you, contact us, reach out, let us see how we can help you. Chances are, if you're having a barrier, we can find a way to overcome that barrier. We'll also say that, as Kiana said earlier, there is free and physically accessible transportation on a limited basis that is being provided in Baltimore City by MJM Innovation. If you call the call center, you can schedule a ride. The rides will work on the weekend, but you are not able to schedule them on the weekend because their office is not open on the weekend. But vaccine clinics on the weekend can still be served by MJM.
Great, thank you. We had another question about, while we're talking about vaccines, where does how important is continuing to wear masks, even for those of us who are vaccinated? How important is masking in conjunction with the vaccination process?
They are very important because you don't know who around you has been vaccinated and who has not. And also, even though, we have some children that are eligible to get vaccinated, younger children are not. So it may, still be a discomfort, but it's still safer. And I would say if you're able to mask, I would say keep your mask on, just because you just don't know who is vaccinated around you and who is not.
This is Cheryl. I will add to that too, that we need to remember that we don't wear a mask to protect ourselves. We wear a mask to protect those around us. And so while it is true that the CDC has stated that, if you're fully vaccinated, it's okay for you to go without a mask, we need to keep in mind that it's not just for us that we wear it. We wear it for those around us. And for those of us who are either not able to wear a mask and thus are at higher risk, or for those of us whose immune systems are not as good, either due to underlying condition or due to medication that we take, when others are not wearing masks, or when we can't trust that others are going to wear masks around us, it forces us to stay inside. And it raises the fear level that, I'm putting myself at risk just to go to the grocery store. So the way that we can help people not get sick and not die is to keep wearing our masks for the safety of everybody around us and not just ourselves.
Great. We got another question from in the chat asking, can a person get a booster and the flu shot at the same time? Are there certain conditions in which one should try to avoid getting the shots together? Or like such as individuals with immune concerns? Or should people be spacing them out?
Well, the CDC has recommended that it is safe to get the shots at the same time. But I don't, Cheryl, do you have anything to add?
This is Cheryl. The only thing I would add to that is that when the CDC makes its recommendations, it's making its recommendations based on general population.
Yeah.
If you are someone who tends to, when you go for your vaccines, you space them out because of side effects, or because it lowers your immune system or kicks it into gear when you get a vaccine, you might want to take that into consideration for this vaccine too. In other words, it's not going to be different than any other situation that you are in. It's that there might be some different effects. Everybody responds to medications differently. And so you want to think about how you typically get your vaccine. And if you are one of those folks for whom getting to a vaccine, whether it be flu or COVID, is difficult, and you think that you can handle side effects okay, and you have the flexibility in your home life and your work life, that, hey, I'd rather just get it all at once, get it over with, get it done. The CDC has said, we have studied this, people are safe to do it. So yeah, there's nothing that the two of them don't interact with each other. I think when the CDC started studying how to do the flu vaccine and COVID vaccines, whether to do them together or not, the thinking is that the flu season this year seems to be trending towards bad. And so a lot of the same symptoms come up with COVID-19 and with the flu. And we're expecting a potential surge in COVID-19 this winter as well. So doctors and the CDC, I think, are concerned that if people wait too long, they won't have the immunity that they need when the flu hits. And we're still at risk of COVID. So as long as it's safe to do, here are both at the same time. Go ahead and get it done.
Great, thank you. Another question that I have is, I would like to know more about the community ambassadors. I think this is a great idea, and I'd really like to hear more about how the city is using ambassadors to get the word out. And, you know, some of your, and Natasha's already shared one of her experiences of talking with people, but I'd love to hear more about the ambassadors.
Okay. Well, for myself, I've done a lot of the site assessments when the city wants to do a clinic. I go out to make sure see what features they have, if they're fully accessible or not. But also I do a lot of outreach at different events that the city has. It could be tabling at a nonprofit or tabling at Patapsco Flea Market, just getting the word out and letting people know that we're here and what all we have to offer.
Hi, this is Natasha. In my case, I'm not as mobile. I have an issue with my power chair. So mine is more on the research end. I do a lot of information sharing. I share events for my community partners about COVID clinics or outreach events where they share information or have COVID vaccination shots. I try to do a lot of what I call online presence. So I share the weekly schedule of what BCHD has in excuse me, for what the Baltimore City Health Department, my apologies, has currently for clinics that are giving out shots. And cold calls where I call different organizations, schools, um, community organizations, and see if they are fully abreast of what's going on with COVID. Do they need more information? Do they need stuff virtual, in person? Would they like help setting up a virtual clinic? Or if needed, do they need assistance getting a mobile van? So that's what I do. Yes.
Fantastic. Cheryl, have you guys found that you were able to bring issues to the health department when doing site selections and setting up clinics that the hadn't been considered? And because one of the important parts of you guys being ambassadors is representing the community of people with disabilities. And have you had some successes where you've been able to make some changes because there was something nobody was thinking of and you guys went, hey, wait a minute?
Yeah, this is Cheryl. I appreciate the question very much. So our values team does work a little bit differently than the other values teams, in that our primary function is helping the city and its partners understand how to do accessibility and inclusion in a better way than it started out as. So we are coming from behind the 8 ball because the project was up and running before we were at the table. And anytime that happens, it's an uphill battle. And we also recognize that this is a city and its partners. So it's a very large animal with a lot of moving parts. And so I'm so proud of my team. I can't even tell you how excited I am for the work that they do all day, every day. And those of us who have been in disability rights for many, many years know what it's like to chip away at the mortar a little bit at a time, and just the repetition and the amount of effort and time that it takes to help train folks to look at things a little bit differently. That all being said, as much of an uphill battle as this sometimes can feel like, we've made tremendous differences. And we see that in little tiny ways every day. Sometimes I'm not even sure that my ambassadors see that very clearly, but I see it from leadership level, is that individuals who we have a consistent relationship with on other teams have started relating to us in different ways. They've started asking more questions. They've started reaching out to us. Today, I got a cold question from someone about making sure that a flyer for a new vaccine clinic was not only being translated into the Spanish English version, but that Spanish was also text only. And that Spanish was large print. And so we're starting to get those cold questions, so to speak, like out of the blue. Is like people are thinking about things in a very different way. In leadership meetings, I have often gotten the comment that we're revamping this space because you all are here. We would not have done this otherwise, or we would not have known to do this, and thanking us for it. So while sometimes it might seem like a small thing, like the chief medical officer of the city physically describing herself while on a webinar, that's a huge difference from what that was a few months ago. Now the trick will be not just doing it in front of our particular team, but making sure that this is a domino effect and goes beyond our project. And one of the pieces of this values project is to help the city and its partners move forward beyond COVID. And this is a part of it. And once again, I'm going to praise this group of mine because when you've got an entire city and we've got, what, 4 of us who are working with all of them to make formats accessible, to make their clinics accessible, to relate to people in different ways than they're used to. It's a lot, and it takes a lot of time and effort that is above and beyond what some of the other groups have had to face in terms of barriers. So once again, I cannot be prouder of my team.
That's fantastic. And I think the name change from the homebound vaccine program to the Vax at Home is an example of some of the advocacy work you guys have been doing with the city.
Yes, this is Cheryl. Thank you. That actually was the brainchild of one of our ambassadors who's not on the call tonight because she's doing another event elsewhere, but that was Tyler, who helped us get that done. And it was over a couple of months. So again, something as simple as that name change opened up the doors to many more people being able to get their vaccine. Yeah, very proud of the work our team does.
Fantastic. Are the ambassadors also available if, to talk peer to peer? So if people had specific questions relating to having a disability and trying to get vaccinated, is that another function that that you ambassadors do?
I mean, it is something that, we're all open to doing. A lot of the times, we'll say like with, Natasha, since she might not be out of the field as much, but yeah, we're definitely open to, like speaking to people and, just because sometimes, it might be, they might not want to, speak up in a forum like this. They may want that, like one-on-one conversation, and we're definitely all open to that.
This is Natasha. And yes, while I am not as mobile as everyone else, when I do make my cold calls, I am constantly picked apart question wise.
Yeah.
What do you need this? It almost feels like I'm being quizzed, but I have to step up. And about 90% of the time, I have an answer. Once in a while, I get caught off guard. I have lots of links to tell people about. I can tell them certain phone numbers, and every now and then, I just have to be honest and say, well, you got me. And then we laugh and we keep going from there. Also, I'm a fact checker, which is excellent when you're sharing information online, especially about something that has been mired in political intrigue and all the Illuminati stuff. You know how they do it online. So I fact check.
Absolutely.
Oh, yes, because the
Yeah.
boogeyman works for the government and they're trying to kill us with shots. We get it. So fact checking, making sure I'm on the ball, asking the right questions. And if somebody gives me some flimsy flyer about some event, okay, it's on this day. What time? Can we come this? Are you handicap accessible? I ask these questions, and that's how I do what I do from home.
Fantastic. That's awesome.
This is Cheryl. I will also add that I'm not even sure that the ambassadors sometimes realize how much of a difference they're making with their peers. But I have had individuals in the program come to me and self-disclose that they have a disability or that someone in their family has a disability, and that they didn't realize how it was impacting their lives or how COVID was interacting with that until they interacted with our team. And so I think we are making a huge difference. And that independent living philosophy that we on our team have tried to live through this project, I think is making a bit of difference.
That's great. Cheryl, I don't see any more questions. This has really been an interesting conversation. I've learned a lot tonight myself. So I don't know if you guys had anything else you wanted to add.
This is Natasha. The only thing I will always say to anyone is community interaction is awesome. If you have connections, keep them, keep in touch, see what they're about, ask the questions. If you don't see them doing anything COVID wise, bring it to their attention. You know, this is what I do now. Do you have this in place? Do you need any questions asked? Are you having an event? Do you need us there? Jump in when you see it. You'd be amazed how many opportunities are there when you don't just slide a flyer by, but you actually speak to the person that's doing the event. And no, you might not be able to do something that's happening in 2 weeks, but they could be having something that happens twice a year. You can be setting yourself up for that. You could be meeting other people and doing events other places. Networking is awesome. So that's something I'm gonna put out there no matter what job I'm doing. And I'm done. Thank you.
This is Cheryl. I would just say in closing that anyone who has any questions about COVID-19 or about the vaccines or treatments, feel free to reach out to the City Project. Feel free to reach out to us. If you are interested in having us do a Q&A with a specific group, we're happy to do those presentations. We're happy to do one-on-ones. So whatever you might need or want, we're around and we're happy to do it. So thank you for participating tonight, hearing us out. Feel free to share this video when it's available, and we'll go from there.
Great. I plan to publish the links that Kiana, the phone numbers and the website links that Kiana gave us with the video, so people will, can, if they have any questions, it sounds like the call center number is the one to call to connect up with anything, any kind of information that you need on getting vaccinated. So thank you guys very much for spending your evening with us. And Cheryl, if that was everything, we can close this out for the evening. And thank you all for joining us.
Yes, thank you. Appreciate it. And thank you to our interpreter.
Yes.
Shauna,
Yes.
you were awesome.
Great job, as usual.
Yeah.